These are the signs that you may need back surgery in general. Everybody's different, right? First of all, to qualify this, we're all different chemistry sets. You're different from your friend or your wife or girlfriend or whoever you're with, and we're all different. So everybody has different stories related to their backs. One of the problems that we have is people say, well, my friend had back surgery and they didn't get better. And I'm like, well, yeah, they have a scar on their back, but I don't know what they did inside. So trying to know the signs of whether or not you need back surgery can be tricky, but basically this. If you have pain in your back, and I'm talking about the low back right now. So if you have pain in your back, going through your buttock or down your leg, odds are you may have a degenerative herniated disc or a bone spur with degenerative joints causing back pain and irritating a nerve causing the buttock and leg pain. If this has gone on chronically and you've done at least a few months of physical therapy, you may have tried injections, shots, anti-inflammatory medications, acupuncture, chiropractic, manipulation, herbals, CBDs, whatever you want to try, do it. If things aren't getting better and you see that the pain is still there and it's not livable, it's affecting your quality of life, then seek an opinion because you may need back surgery for that so that you can live a more normal life. The other signs would be motor weakness. Is my leg weak? This also applies to the cervical spine in the same way. If the nerve is pinched in the neck or low back, you get weakness. Is that weakness causing your muscles to be weak in the deltoid, bicep, tricep, or hand? Leg can be weak in the thigh, calf, tibial area that bends your foot up. Those are very important that you pay a lot of attention to because weakness means your nerve is getting damaged and it needs to be released so the nerve can recover and you can make a muscular recovery. The longer you wait with weakness, the harder it is to recover that weakness. So those we consider to be a more urgent sign, weakness. Numbness is not as urgent, but pain with numbness can be more urgent because the sensory part of the nerve is also getting pinched. Sometimes I see patients that have weakness, sometimes they have numbness, sometimes they have both. Sometimes they have terrible tingling and burning sensations, feel like bugs are crawling on their arm or leg. This is a sign of nerve irritation. It can be treated medically for the most part, but if you need surgery, that might be a sign that you're a candidate for spinal surgery. And it's usually more of a less invasive to relieve pressure on the nerves versus the more back pain patient, which I covered in another video, which may need an artificial disc replacement or maybe possibly a fusion or a combination surgery, which I call a hybrid, where we might fuse one disc, do an artificial disc at another to maintain mobility. I have to assess whether you're a good candidate for those types of surgeries. But you as a patient need to understand the signs. Chronic pain not getting better, chronic pain even though you've tried therapy and all the other modalities I mentioned, associated possibly with weakness, possibly with pain, numbness, tingling, all telling me that nerve signs are being affected. You've given your go on conservative treatment, but you're not getting better. Those are signs you may be a candidate for back surgery. Get an opinion. You know, you can come in and see us surgeons and talk to us and get our opinion without having to have surgery. We don't tie you down to the table or anything and make you have surgery. You come in, we talk about it, and you decide yes or no. We're good, we're busy, we have plenty of work to do. Happy to help you or at least give you an opinion. So I encourage patients to please come in and talk to us, at least get an opinion. Get everybody's opinion, from your herbalist to your surgeon, and see what fits for you. We're all different. Let's make the decision there, and we go from there. And if things don't work out with the other modalities, well, maybe you have to have surgery. I don't know, but let's find out. I hope that helps you. Talk to you soon.